Why wouldn't you want to have, given that story you just told, why wouldn't you want to have a public option that you could say to your employees, go to this public option, it's a generous program, it's as good as what I'm able to buy for you, and be able to get it for, say, 10% of payroll?
I have no difficulty with that. My hope is that if that option were available, and I would hope from this process that if it's done right, the public option would serve a couple of different purposes. One is, and it's very important, is that it would make it easier for me as an employer to understand and explain to my employees what they're getting for our money. Because they're making a contribution too. I don't pay the whole freight on this. And if we could do that, and there was a plain language component of the public sector solution, whatever form that public sector solution takes, then the private sector, which I think has some conflicts of interest that it tends to camouflage in the way it presents the product, would be forced to reveal what the real costs are.
Tell me how they camouflage it.
Well, they camouflage it by presenting me with a 3/4-inch thick booklet of arcane, legalistic language that explains what the policy really is. And what I'm looking for is a very plain English thing that says, here's what you're getting. This is what the co-pays are. This is what that's all there. What the deductibles are. This is how much you're going to spend each month. But here are the limits of the policy. If you go into the hospital and you have a serious problem, and that problem is, let's say, cancer. The average cost of, say, a cancer treatment in the New York metropolitan area for a serious illness is, say, and I'm making all this up. I'm not, like I said, I'm not a policy expert, but this is sort of my thinking. And that problem, that illness, on average costs $1.5 million to treat in New Jersey. Okay? Our policy only covers $1.25 million. You're going to be on the hook for $250,000 because when you go in the hospital, you sign that little document that says whatever the insurance company doesn't pick up, I'll pay. So one of the things I'm hoping is that if we have that sort of transparency in the process, then we can also have an honest discussion about medical bankruptcy. And then we're going to really know what health insurance should cost and how we can fully cover everybody. Until we have that kind of transparency, I don't even think we know how much health insurance really costs.